Well, for a long time, even veterinarians missed some of the signs of pain in cats. Well, we know what to look for now, and we have some really good treatments. Let's talk about some of the subtleties of discerning discomfort in kitties and making it better. In case we haven't met, I'm veterinarian Dr. Jeff Nickel, along with our family cats Tony and Gaston, and of course our family Border Collie Miss America, who would never miss one of these events. We could be talking about elephants, and she'd be here. So, thank you for tuning in, and I'm open to questions at any point. It doesn't even have to be on topic, but I have a lot of information to share, research-based, on pain in cats and how to recognize it and why it's so darn challenging to recognize it and why it's so essentially important to get ahead of it, very often with medications, but I have another wonderful, relatively new electromagnetic field device here that we'll talk about that too. So, by all means, if you can hear me loud and clear, would you hit the wow button just so that I know that, this is coming through? And if you find this information helpful, hit the heart button so I know that I'm doing something valuable. Please tell me that you're here and where you're from. I get a lot of people who are attending every time, and it's just wonderful to see you. Even if you don't have cats, you might learn something useful. So, thank you for being here. And I would love to ask you that if you know somebody with cats other than yourself, tag them, put their name in the comment line so that they can tune in either a little later in this Facebook Live, or they can watch it later. It's going to live on in my Facebook page. And people can send me questions after the fact. That part doesn't matter. Now, gentlemen, I hope everybody is practicing good decorum here. So let me just talk to you a little bit about a case that I had. When we talk about pain in cats, we're often talking about injuries, skin wounds. Cats have fights and get abscesses, hit by car problems, fractures, that kind of stuff. And surgical wounds. Some cats need abdominal or chest surgery, need masses removed, dental procedures, dental extractions. Tony, what are you doing, boy? Here's the toy right here, and you lost some of the special treats in there behind me on the chair. There you go. So Tony's feeder is empty, Carolyn. And so Gaston's still got a little bit left in his. But he dumped his behind me on the chair. So anyway, he's these guys have to, oh, wonderful. Geez, we got a trade. There you go. There you go, Tony. So anyway, here's a story, not about a fracture. I'll explain what's going on with it, and you can think it through with me. But this is a cat named Jeremy, lived with a very nice lady, indoors exclusively, young 2-year-old ragdoll cat, male, neutered. And he had reactive aggression toward his person. And not just hissing and growling and swatting, but he would bite her and cause an injury. Well, people love their pets. It doesn't matter that they're, treat them badly sometimes. You love them anyway. Well, this lady certainly loved Jeremy and needed something done about this thing. But let's look at human nature and our emotions. We really do love our pets. And when they suddenly turn on us and threaten us, it can make you mad. And it's a very natural impulse to swat them, to say, we're not going to tolerate that behavior. Well, here's something we know very clearly about behavior of cats and dogs, and horses and a lot of other creatures too, is that when you punish in the moment, you actually, if you do it consistently and with enough strength, as we say, in other words, hit them hard, you really can reduce the frequency of the behavior, but you've taught a cat in particular, much more than other species, the masters of one-event learning that they are, that their person isn't nice. Well, we have pets for the relationship, don't we? We have them because of behavior, because we need them in our lives because, well, aren't they all emotional support animals? I mean, we wouldn't have them if they didn't provide us that kind of joy and comfort. And, well, you can make your relationship with your cat go south like real fast if you punish physically. And even yelling, even verbal reprimands can do it as well. So that kind of thing, as much as that is the impulse that we have when a cat takes a swing at us, it should be off the table. And in fact, you should back away. One of the other peculiarities of this species is that they can maintain high levels of excitatory neurotransmitters in their brain, sometimes for hours and in a few cases days after a high arousal aggressive event. So you back away from that cat and you don't interact. Contact a specialist. So here's this guy Jeremy, and what the problem, and I had his person shoot some videos of this little guy, and she used a home surveillance camera actually, and took some videos of this little cat when he was, my light go away here? Let me check my light again. Wait, whoops. Well, that didn't help. Hold on, let me check my, no? Okay. I guess we're all right with light. It seems like it's coming and going a little, but we'll be all right. Well, so here's what would happen would be she was brushing him, just grooming him. And she thought he was enjoying it, but when I was watching that video, I could see him gradually ramping up his agitation and laying his ears back and turning his head away and watching her with the white part of his eye just visible like a crescent moon, what we call a whale eye. And then he would strike, and it would catch her off guard. Well, by going through the videos with her, I was able to educate her and say, this is what's starting to happen. And so when you see these early subtle indicators, that's the time to quit. Well, with more history on Jeremy, it became clear that this little guy was an over-grooming cat. He would lick his fur a lot. And with examination of his skin, it became clear that he was allergic and he was very uncomfortable. So do you think of itching as pain? Well, it certainly is, especially in cats. And in fact, I'm going to share some research with you about how it worsens over time, even if the initial cause has been managed and eliminated. So among other things that I taught Jeremy's mom was not only to back away when she saw the earliest indicators, but also we were going to get that skin to feel much, much better. And then we were going to desensitize him to being groomed and touched by his person. So he learned that good things always happened, but she would quit early and teach him to tolerate just a little more and gradually a little more, and to make it a bonding kind of event between them. And it was a long process, but he ended up doing much, much better, in part because she had recognized early that she had to exercise her kindness. And you know, if we weren't kind, we wouldn't have pets in the first place, would we? If we didn't have empathy for somebody who was different than we are, I mean, a lot of us have dogs and cats in our homes, and we realize that their behavior is different. And if we're going to see them as being different than we are and recognize those differences and make allowances and accept those differences, we can bring out their best. So again, you don't punish and yell, and it's great. It's a great exercise for working with other people too, isn't it? Because you can share that with other people. And in fact, the benefits that we get back with showing empathy towards our pets, well, we feel better, and we share that with others. Even if we don't do or say anything in particular, people pick up on it. So the empathy and the kindness, don't discount that. That's really essential. So it's an essential skill with respect to understanding pain in cats. You know, dogs, for example, are not little people in furry suits, nor are cats. But dogs socially have a great deal more in common with us than our cats do. It's quite remarkable how great of pets they make, considering that socially and in terms of interactions, there's a lot that they don't share. So we have to really get our empathy thing going and say, all right, you're different, I'm going to listen and pay attention. So let me share a little bit of research-based information with you on this thing. A definition of pain by the International Association for the Study of Pain, which uses animal models for research but is largely directed toward people, and we find that the neurologic system, the neuroscience behind this, is essentially the same among all mammal species. And it isn't just about how it feels, but it's how it makes you feel. It's about the emotional component of pain. It's a suffering and feeling of hopelessness, with chronic pain in particular. Well, that sounds pretty miserable. Well, I'll tell you what, if you've got chronic pain, or if you know somebody who has, you can get a sense of the way it changes people's lives, and in some cases permanently. Well, the same thing happens with pets. So we've got to be paying close attention. Now, acute pain changes behavior. It's like, acute pain is like right now, you touch the hot stove, and it's an adaptive mechanism we really need acute pain because it gets us away from the thing that is damaging our body, our skin, our muscles, our blood vessels, and it gives us a chance to heal. So it's self-limiting, okay? Especially once the injury heals, the pain goes away. So acute pain isn't the worst thing in the world. It's chronic pain that goes on indefinitely. That's the problem. It persists beyond the expected healing period. And it can have significant effects, according to the International Association for the Study of Pain, has significant effect on physical well-being and psychology of the sufferer. Okay? It's considered a disease state because it's long-lasting and it just keeps going on. So, anybody here ever had a cat where you were suspicious of that? Let me know and tell me what you noticed, and we can talk about that a little bit. Now, neuropathic pain, that's pain of the nervous system, can occur not just with spinal injuries and injuries to the nerves of the limbs, for example, but a declaw procedure when the last little part of the fingertip is removed at that last joint. That damages the nerves, of course, and that can be long-lasting. And in fact, we have a pretty clear understanding of some of the long-term behavior disorders that result from a cat having been declawed, especially when they're declawed as adults. Less so when they're youngsters. But urine soiling in cats, the most common behavior problem in cats, is more commonly seen in cats who've been declawed. So, those nerves tend to fire spontaneously and they become hyper-responsive to even normal stimuli, like Jeremy, okay? Just keep on firing. So when we've got pain in the nervous system, we want to put the kibosh on that ASAP. So surgery is one of our big issues, and it doesn't have to be just a declaw. It could be a fracture repair. Well, thank you. Somebody sent me hearts because I'm doing something helpful. Thank you very much. The feedback counts. But neuropathic pain can occur with many other issues, like chronic dental pain can affect the nerves that supply the face. And, oh, Elizabeth, thank you for showing up. I'm delighted to see you here. There are emotional and psychological elements in this thing, in pets and in people, and we've got research to support that. One of the biggest problems that we have, and this, more veterinarians are getting much more aware of this. It's becoming very commonplace for veterinarians not only to dispense pain management when they send a pet home from surgery, but to start the pain management prior to the procedure itself. In fact, very often it's best done at home the night before the pet is brought in for an elective procedure, including stuff that we consider routine, like spaying and neutering. And you go, my goodness, how many thousands of those have I done in my career? Yeah, well, I wish I had $1 a day, or I'd saved $1 from every one of them. Well, the truth is that we need to be giving pain management prior to the procedure. And I would encourage you, if you don't have a good veterinarian that you already know and trust, when you decide you're going to pick one for a new pet, cat or dog, ask them about their pain management practices. Ask them if they give pain management starting before the procedure, because what we're doing is we're preventing pain windup. We're putting suppression on the pain response, and so yeah, we're triggering those pain receptors, but they just don't react that much if the pain management, the medication, is already on board first. We've got a whole long list of them that we use. We are not shy of using opioids, although in cats, we seldom need them very long, and in fact long-term, and I'll talk about a couple of the very common and safe long-term medications for pain in cats, particularly older cats. They'll do pretty well day to day, and then they might have a bad day. And boy, if you've had chronic pain, you know that for some reason or another, you have a bad day. And so we can have an opioid called buprenorphine on hand at home for as-needed use. Very safe. Don't have to worry about addiction that way. But opioids, not a four-letter word. It's unfortunate that so many problems have developed with them because they are heavy hitters when it comes to pain. We just have to be careful with it. So, permanent changes in the nervous system can occur if we don't prevent it and if we don't stay after it and continue the treatment for pain post-surgically long enough. And sometimes that's more than just a few days. It could be 7 days, 10 days, depending on the age of the cat, depending on what else is going on. We need to custom fit it to the individual. Okay? So, anybody have any comments on that? I mean, if you've seen this thing, here's what the problem with cats is that people and dogs, one of the big things that we have in common is that we're very highly social. And what that means is, among many things, is that we live in a group and we communicate with other members of the group. Dogs do that in their social groups, people do in their families. And if you live by yourself, most likely you're going to be communicating with your friends and your coworkers, including how you feel. And you may not necessarily say how you feel. I feel great today. I don't feel so good today. But we carry it with us and people can tell. It's natural. Okay? Well, cats don't do that so much. They are not that highly social. Certainly they're capable of social interactions. Nobody's socially interacting with me up here because I don't have any more cat treats. Tony T. Well, you can jump up here and have that little treat. Here, it's right here, baby. Look, that's a good boy. Here, it's right here, son. There you go. So cats don't say anything. They typically do not cry out to their comrades for help when they're sick or injured. They typically tend to get small and hide out and do their best to get well on their own. Many people say, well, I had this cat, really liked him, and then he just took off. I think he just moved in with another family. Maybe he got sick or hurt and holed up somewhere and didn't make it. And we have to assume that about cats, that they're not going to say anything. They're not going to make it clear, that they're going to hide it. And the reason is that they are a predator species for sure. I mean, they don't eat salad and potatoes in the wild. They eat other creatures. They are total carnivores. But cats are also a prey species. They're small, 8-10 pounds. And in the wild, a big dog, a fox, a coyote, almost anything can take them down, a hawk. And so they have to watch out for themselves. And so because of their sort of low social nature, they don't say much. And you'd think, well, gee, this cat loves me. She sits in my lap, I pet her often, and we're the best of friends. Surely this cat would say something, make it clear to me that she was uncomfortable. They're cats. They're not going to be little people in furry suits. And it doesn't matter how much time we spend with them, they are still hardwired and genetically programmed to behave like cats. So we are not going to ever assume anything. So here are some of the things that we should be thinking about, especially with older cats, because just like anybody else who gets older, our joints aren't necessarily kind to us and other body parts and functions and bits of anatomy. But cats of any age who, and I have the list here so I don't forget to mention any of them to you, inability to rest or sleep. Some cats are restless. They just don't sit still and kick back and relax the way they naturally maybe used to. They're just not as active as they once were. They just hang out more. Well, normally cats aren't running all over the place the way dogs do. They tend to just lay still and relax. So if you think that your cat may be hanging out a little more than normal for that kitty, play with a toy. Get these cats to enjoy jumping around. Come on up here, Tony. And so, come in. You can jump up. Look, Tony T. Come in. There you go. If Tony stops jumping up and doing the kinds of natural things that he should be doing, or Gaston, here he comes. If they stop doing that, or if they look like they want to jump up but they don't, these are little tests that you can give your cat to make sure that, yeah, they're still doing what they ought to be doing. You don't assume anything. And you do have to put them through little tests, and that's especially, Tony's almost 14 years old now. That's important. So, changes in their hair coat. Oftentimes they don't groom themselves very well because it hurts too much to turn around. So if you think, gee, hair coat is a little unkempt, could be other problems. There are lots of physical disorders in cats, including mouth pain and dental disease, that will put the stop to them grooming, including reducing their appetite. But joint pain, certainly a big factor. Obviously, physical exam by a good, thorough veterinarian is going to be the best thing to do. Discomfort when touched. They're not all like Jeremy, where you pet them or brush them and he turns around and inflicts a significant wound. But sometimes they just don't want to be touched, or when you're petting them, they kind of shrink away. One of the most valuable ways of testing a cat's general pain level is a very gentle, very soft touch. Because when you stimulate those little nerve endings in their skin with a very gentle touch, they function differently than when you give them a firmer pet, and you're going to pick up more discomfort. You're going to test them more effectively with a very soft touch sometimes. Doesn't mean you do that all the time. It's just a diagnostic test that you can carry out at home. Okay? Vocalizations. I just got done saying that cats don't cry out for help, but there are some cats who walk around the house and get a lot more vocal and more talkative than they used to. And it's the changes. These two cats of ours, they're pretty different creatures. And it isn't just because one's much younger than the other. They're just different personalities. And so the comparison shouldn't necessarily be between one of my cats and the other. It should be between how this kitty, Gaston, behaves now compared with how he used to behave as a younger cat. Facial expressions. Some of them are going to stare. Some of them get this furrowed brow. Well, Jane is here. My sister-in-law. Thank you, Jane. You're very nice to show up. Jane has this wonderful black lab. They don't have a cat right now, but it's nice of you to come anyway. So, self-mutilation. Cats who lick, 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 lick. You remember I talked about Jeremy, how he was over-grooming? Well, sometimes if cats have a particularly painful joint, they will lick that part of their leg, for example, excessively. Well, cat didn't used to do that. Be on guard for that. And rapid breathing. I've got Miss America here who's panting because it's summertime. Cats don't generally pant that much. They're smart enough that when they start getting pretty hot and uncomfortable, they just lie low, right? But a cat who starts to pant, and you think, why in the heck are you panting? It could be pain. Okay. So, anybody knows that kind of stuff? So let me give you a modern day wonder drug. It's not perfect, but it's called gabapentin. Gabapentin. And I have a question here. Oh, Melissa, great. That was just a text. Okay, she's not here. She's the manager at the specialty hospital where I practice. I thought she had a question. It came in as a text. Anyway, you want gabapentin if your veterinarian is familiar with it. Gabapentin is an extremely safe medication. There may be no upper limit to its dosing. We use a full 100 milligram capsule for many cats the night before, and particularly about 2 hours prior to bringing that cat into a veterinary clinic just for routine exams and vaccinations. If that cat has shown signs of nervousness, discomfort, anxiety, sometimes even reactive defensive aggression when the staff or the doctor are trying to examine the cat, well, who wants to put their cat through that kind of struggle? You don't need it. And the gabapentin is a great pain reliever, but when you give it at a higher dose, like a full 100 milligrams, and you can open the capsule and mix it with their food, a small amount of food, so they get the full dose pretty quickly, then we rely on its side effect of a moderate degree of sedation prior to coming into the veterinary clinic. And typically a cat who's had a full 100 milligrams of gabapentin prior to coming in, well, they're pussycats. They tend to relax. We can examine them and vaccinate them, take a blood sample if we need to, very often get an x-ray without struggle. And avoiding struggle in the veterinary clinic is super important because it's very stressful for the kitty and it can predispose them to some other problems, other physical problems, not to mention the fact that they really hate coming to the veterinary clinic after that. And then we end up with a cat that people don't want to bring in, understandably, because they're miserable. So gabapentin, if your cat's nervous about going to the veterinarian, ask your veterinarian to prescribe it. It's inexpensive. All pharmacies have it. It's a human medication, and cats like the taste. I mean, it's pretty hard to beat. So be watchful for this kind of stuff, and if you think that maybe this is going on and your veterinarian palpates your cat's joints, extends the hips and the elbows and the shoulders, and sometimes they'll fight us when we're trying to fully extend a hip, for example, and we get clear that, I think we've got a degenerative arthritic problem in that joint. But they don't always. The adrenaline's running high even if they look pretty relaxed, and they sometimes don't show the pain, and we'll end up sometimes giving a little sedation and then taking x-rays. X-rays can tell a whole lot of information that a dog might share, a person certainly would. You know, you go into the physician, especially an orthopedist, and you have a pain problem, and they say, all right, on a scale of 1 to 10, we all know how that works. Well, dogs aren't very good at that, and cats are terrible at that. So we've got to just think about it, watch very carefully, be very observant, do a thorough exam, and take x-rays. So long-term pain with cats, especially joint pain, there are 2 medications, and I'll try to make it a point to put this in my comments after we finish this Facebook Live. One is called Meloxicam, M-E-L-O-X-I-C-A-M. I have to think it through. I wouldn't be any good at a spelling bee. Meloxicam comes as an oral liquid, and it is safe for use daily, long-term, even in cats with bad kidneys, which is an important point because many older cats, frankly, all older cats have failing kidneys. Doesn't mean it happens all at once, but all of their kidneys wear out. There is no escaping if a cat gets to be 14 plus, usually 12 plus. So we're very careful about the medications we use, but Meloxicam is safe to use. Another good one is called Onsior, O-N-S-I-O-R, and your veterinarian should have those things on the shelf. And they're prescription medications, and again, not everything is right for every kitty, but they can make a huge difference, and we can add gabapentin long-term as well. So now, what about supplements? Glucosamine and chondroitin, you know, a lot of us take that. A lot of us give that to our dogs. Well, cats can take it as well. It's what's called a chondroprotectant. What it means is that it protects the cartilage surface in the joints. It improves their lubrication because it has antioxidant properties, and it tends to clean off these little tiny projections of oxidative molecules that end up causing dry joints and discomfort. So glucosamine and chondroitin, it is not an anti-inflammatory, it is not a pain reliever, but it improves the health of joint surfaces so that they are less inflamed and painful. So, you know, as cats get older, boy, it's a great daily supplement. And you can get those things over the counter. You can get them online. Now, let me show you something else. This is produced by a company called Assisi Animal Health, and it's called the Assisi Loop. And they make this smaller size and a much bigger one. And this is a pulse electromagnetic field device that is specially approved for use in cats and dogs and horses. And you simply lay this over the affected joint, and when it's turned on, you can see it flashing. And you do twice daily, 15-minute treatments. And my cats are going off hunting for snacks around the room here. But for example, if I had this problem with Miss America, who's lying down now, you can't even see it. You hold this over the shoulder. There's actually a little vest that you can get for them, and it velcros to it. It's got little velcro straps. And this thing has made a very big difference. It has real robust research behind it, and you can use it with medications or instead of. It is a prescription device. It's called the Assisi Loop, like St. Francis of Assisi, and your veterinarian can prescribe this for your pet, your cat, through the Assisi website. But you can learn a lot more about this by going to Assisi, A-S-S-I-S-I, AssisiAnimalHealth.com, and you can learn a lot more about the Assisi Loop. But this is a wonderful device, and it's entirely safe. There are no downsides to it, but you really should have a diagnosis, and that's why you're not allowed to just order it on your own. You can go to the website and put your name in and all that stuff, and then put your veterinarian's name in, and then the doctor can approve the prescription of it. So a big believer in that one. You know, the truth is, when it comes to pain, you know, if you've ever had it or known anybody who's got chronic pain, you will do anything. Well, we have a lot of tools nowadays, and it doesn't make them all best for everybody. But the Assisi Loop in particular, I keep getting this cat toy caught up in it. The Assisi Loop in particular is something that there's hardly anything that it's pain-related that it won't help. It's not only good for joints, but internal problems as well, including smoldering pancreatic disorders and liver diseases. It can be very helpful for the pain. The other thing I'm going to mention lastly is some management things you can do for older cats. Because they're less active, their nails tend to grow longer. If they're not scratching on a scratching post or a fireplace log or something like that, they can get real long nails. And then when they walk, their toes can splay off to the side, and they can develop worsening arthritis in the joints of their paws, where they probably already have a problem, and it gets worse. So you want to stay after their nail trim. You want to make sure that the litter pans are easy to access. Deep, big litter pans are often more likely to be used by cats. I encourage people to take a utility knife and cut down one area of a big litter pan to make it easy for the cat to get in. And if they have a tendency to, kick the litter out, then you can build a ramp. And you can get ramps, by the way, so that they can very easily walk up the ramp, get into the litter pan, eliminate, and come back out again. Because one of the problems, in fact, one of the symptoms sometimes with chronic pain in cats is that they start house soiling. Well, they never did before. You think, well, why is that happening now? Sometimes they're just too darn painful to get in the pan. It's not just urine soiling. Some will fecal soil as well. So you want to think ahead as they get a little bit older. And in many cases, they'll feel better if you put their food and water bowl up on a little elevation, maybe 6 inches up, just a little, a couple of books stacked up or whatever, so that they don't have to lean over, not just with their neck, but with their whole body, and it makes it much easier for them to eat and drink. And ideally, if we're thinking ahead and if we're watching that cat and using our natural kindness and our natural empathy to say, you're different than I am, and I'm going to be paying attention, and I'm going to be watching, and I'm going to pick these things up early, then you can do these things to help them feel better. So, by the way, if you do order the Assisi Loop, one last point on this, there's a coupon code box in the website. And the coupon code is my first name, Jeff, Jeff. And if you put Jeff in there, they'll give you an additional 15% off the price. And they're on sale right now anyway, by the way. So you can get an additional 15% off just by putting Jeff in the coupon code box. So nothing wrong with another 15%. So I think that's everything I wanted to share tonight. On Monday, for you dog people, if you have a behavior disorder with your dog, then you can send a message on my Facebook page that you want to attend a video conference on Monday, this coming Monday, which I believe is the 1st, at 1 o'clock. And I'll have a few other dog parents in there with their issues, and we can have a group conference. I can give individual help, and I can make this much easier for people. I did one for cats earlier this week, and we're doing one for dogs on Monday. Cost is $60 per family, and we can help you out. Many of these things are going to need a full 2-hour initial one-on-one consultation. But if you just like to share some problems and get some information, I can drill down on it. We do it by Zoom, and many times people show me the pet. So that's Monday at 1 o'clock. But let us know ahead of time so we can send you a Zoom invitation. Go to my website. It's searchable. There's a ton of information I've been loading in there since the early 90s. And so you can find a lot of up-to-date research-based information. And if you subscribe, you go to the bottom of my webpage, you will find you can put in your email address and subscribe. It's no charge. And when you do, I'll send you free at home my pet first aid and CPR guide that I have gleaned from text material and my experience doing emergency medicine. You can print it out and stick it to the fridge, and it can be a lifesaver. So it's no charge to subscribe, and when you do, every Tuesday morning in your email box, you will get my Facebook Live from the week before, just in case you didn't get a chance to go to my Facebook page for it, and you'll get my weekly, what we call the media blog, which is actually my question-answer newspaper column in the Albuquerque Journal from the week before. So you'll get that in your email, and you don't have to go anywhere for it, just open it up. So thank you for joining me and sharing a little bit of your time with me to talk about cats. I love cats. Sometimes people have asked me, well, what do you like better, cats or dogs? Well, they're different, and I love them all, and for somewhat different reasons, but they're all my friends, and I just cannot imagine life without my cats and dog. And my 2 cats are on the floor, gentlemen. Nobody can see you down there. And I'm calling them gentlemen because right now they're being nice to each other, which they usually are, but not always. Just because I'm a veterinary behaviorist doesn't mean my cats are perfect. So thank you again, and have a wonderful week, and I'll see you next week.
Well done, Jeffrey.